Hello, my name is Kim Mason. I'm a registered dietitian here at Carson Tahoe Regional Healthcare, and I'm responding to a question about coconut oil. We have a person asking about coconut oil, and because it's solid at room temperature, is it an okay oil for you? They're hearing from the fitness gurus that in fact it is a good oil. Well, the person would be justified in having the concern, because if other agencies also have a concern with coconut oil, including the U.S. Food and Drug Administration, the American Heart Association, the American Dietetic Association, even from Britain, they have the Britain Health Society that has real concerns about coconut oil because it is saturated. When it's solid at a room temperature, a fat, that's a big indicator that it would be a saturated fat, and in fact, coconut oil is extremely saturated in comparison to other fats, so these societies do have concerns about that. But don't you really wonder about some of the huge populations of people that have actually for generations lived on coconuts and not had big issues? In the South Pacific, a lot of the people, their mainstay as far as what they eat is going to be involving coconuts and, of course, the coconut oil. And they actually did some research, because that question did come up, and they actually did some research on the island of Puka Puka, which I love saying, but it is an island that is just off of New Zealand. This population hasn't really been influenced that much with kind of what you would consider to be more modern types of ways of eating. They're still their tribal ways of eating. And surprisingly enough, in their diet, over 50% of their calories come from fat. Now, if you look at the rest of the world population, it's between 30 and 40% of our calories come from fat. And here in America, we try to keep that below the 30% of our calories coming from fat, because we're worried about our health. This population then should be like heart attacks waiting to happen. And in fact, that's not true. It's just the opposite. They're very healthy people. They don't have any incidence of kidney disease. They have no incidence of heart disease. They actually don't even have incidence of any kind of gastrointestinal distresses, and a lower incidence of cancer. Plus, they're lean and they are in pretty good shape. So what's going on here with this population? A Dr. Mary Enig, who is a renowned lipid biochemist, did a little more research into coconut oil and trying to figure out why it is that it may not be, well, she actually dared to ask the question, just because it's a saturated fat, maybe it's not all that bad for you. And here's what she found out. Because the lipid makeup, or the fat makeup that goes into the coconut oil, is from what's called a medium chain fatty acid. It's actually a fatty acid that's not bad for us. We use it a lot here on medical nutrition in a hospital to help cure patients. The other part that you'll find in coconut oil is a substrate called uric acid. And it is one thing that you'll also find in mother's milk. And so now that opened up a whole lot of doors to say, wait a minute, maybe there is a benefit to this particular coconut oil, and maybe we should look at this further, which now they have started to do. They have actually started to look at coconut oil, and not only as a food, but also maybe as an antimicrobial, and they are starting to look at it in the treatment of AIDS, in the treatment of herpes, even in the treatment of influenza, and finding it to be pretty successful in treating these kind of things. So in looking at that, now we're starting to rethink about coconut oil, and now we're thinking to ourselves, maybe that recommendation should change, and now the recommendation would be maybe taking in a daily dose of coconut oil and keeping it modest. And the recommendation right now is between 3 and 4 tablespoons a day of the actual coconut oil, and including that in your diet. You don't always have to have it as a coconut oil, although there is two different ways you can get coconut oil. One would be in a virgin coconut oil, which you would find, it really has a strong flavor still of the coconut. And if you have a dish that's complementary to that, it's a great way to use coconut oil. The other way is called an RBD coconut oil, which means it's been processed. And what they've done is they've deodorized it and taken out the flavor so you can actually use it with more cooking items, much like you would any other type of an oil. It still has the medium chain fatty acids, which are very beneficial. Both of them would include that. Another way you can get the coconut oil is just by doing coconut milk. It's got it in it, maybe not to the same extent, but about 10 ounces of coconut milk will give you a significant amount of coconut oil, and you can use coconut milk in just about everything. I mean, it goes in a lot of sauces, a lot of soups. Coconut milk is pretty readily available. So overall, I think there has been a change in really looking at coconut oil as being maybe one of the saturated fats that doesn't fit the mold and is probably a good thing for you.